Hello, my name is Andrew Brown. I'm one of the retina specialists here at Gavin Herbert Eye Institute. Welcome back to the AMD Information Bites. Today we'll be talking about a few questions that are common for patients, as well as some of the myths associated with age-related macular degeneration. The first question that is frequently asked is, will I lose all of my vision? And the answer to that question is no. Age-related macular degeneration affects the macula, which is the central part of the vision. The central part of the vision, of course, is the highest acuity or sharpest vision. However, the peripheral retina, which has lower visual acuity, is not typically affected in age-related macular degeneration. In this photograph here, we can see an image where the central part of the image is the sharpest, whereas the peripheral parts of the image are slightly blurred. In age-related macular degeneration, the central part of the vision is affected, and that's the sharpest part of the visual acuity. However, the peripheral retina is unaffected. So because patients remain having peripheral vision, they will not lose all of their vision. The second question is relating to family history. A child of a parent with macular degeneration may wonder if they also will get macular degeneration. And we know that there is a hereditary component and that macular degeneration does occur in families. Being able to guarantee that a person will or will not get macular degeneration is not possible at this time. However, a lot of research is ongoing into making these predictions based on genetic analysis. The more relevant question for children of parents with macular degeneration is what can they do to prevent macular degeneration if they are in fact going to get it. The best thing to do is to avoid consuming things that put stress on the retina. And these include highly processed foods and smoking or exposure to smoke. We know that people who smoke or who are exposed to large amounts of smoke receive a lot of oxidative stress in their body, but importantly in their macula as well. So minimizing and even stopping smoking is really important for preventing macular degeneration, and this is even especially more important in people who may have a predisposition because their parent or close family member also have macular degeneration. The final question that is often asked is, macular degeneration, is it treatable or is it not treatable? Well, it all depends on the form. Certainly the dry form of macular degeneration, which is the slow and progressive loss of central vision and contrast in your vision, can be slowed down. In fact, trying to slow down this progression is a form of treating the disease. By having a diet that is rich in antioxidants, which includes things like green leafy vegetables and fish, can help to slow down the progression of macular degeneration. When we're talking about the wet form of the disease, we've benefited from a revolution in how we treat people with macular degeneration that is wet. We now are able to provide intravitreal injections, which means injections inside the eye of medications that stop the formation of new blood vessels that can leak fluid from those new blood vessels or bleed. In the old days, these kinds of patients who had wet macular degeneration received laser treatment, which could make the vision worse, but certainly could not make the vision better. The new form of macular degeneration treatments for wet macular degeneration includes anti-VEGF medications that work by stopping the new blood vessels that leak and bleed. And so in fact, patients who may have lost vision actually may regain some vision even after treatment. So the wet form of the disease is very treatable. Ongoing research for the dry form of the disease is trying to find ways to slow down this slow and progressive loss of central vision. But we will see in the next coming years how we can start to address this problem more effectively. As always, if you have any concerns or changes in your vision, please see your local eye specialist. Thank you for joining us again for another age-related macular degeneration informational bite.